Hello and welcome to the On the Couch podcast, the podcast that gives you the view from the therapist's chair. I'm your host, John Dennis, a licensed professional counselor. You're listening to OTC episode 38 with licensed psychologist and author Dr. Frank Sileo. Welcome back, OTC listeners. Another installment. So I'm bringing another episode to y'all, and I really hope everybody's doing all right out there in podcast land and just the internet. Obviously, we've had some pretty rough stretches here over the last couple of months with the coronavirus and the quarantine, and it's. At least here in Pennsylvania, we're kind of in like week 6 of being quarantined. So I know everybody's really punchy and really stir crazy. Everybody is just completely overwhelmed. And I kind of thought that this was a perfect timing for this particular interview that I did with Dr. Frank Sileo. So I became aware of Dr. Sileo through a program where he actually was doing a speaking tour and a book signing tour off of his children's books. The World of Possibilities was the book that at the time, and he came to our local library, and I had found out about him and his work, and we actually, and our entire family, went to this book signing, and it was just such a cool event. It was really awesome to see the way he was able to speak to everybody in the room. And I talk about that in the interview. Dr. Frank has just this amazing way about him. He's so intelligent and so good at what he does with working with kids, and he's really doing amazing things with his books. And we talk in the episode about bibliotherapy, the practice or the tool of using books to help anybody really, but a lot of times it's used with children in therapy to teach concepts and life lessons and help them to connect, help them to express themselves through that story, or sometimes they're telling their own story, writing their own book or story. And it's the things that he's doing with mindfulness are obviously so needed, especially at a time like this with everything that we're going through. And I've found so much benefit from his books and through talking with him and just, checking out other concepts that I've worked on incorporating into our family life and trying to work with my daughter, or not work with, I'm not doing therapy on my child, I swear. I might be preparing her for therapy, but in just parenting and, living life with a 7-year-old and a 2-year-old and, trying to get them to notice things, pay attention, slow down. And for myself, really, I have a very ADHD mind and am not very practiced at pausing, at mindfulness, at, drawing my focus inward. And you hear a lot about that in today's culture. I think mindfulness has gotten a lot of airtime, and rightfully so. It's very important practice. All of us really should know it and use elements of it. But I'm hopeful that in the years ahead that will become even more of a focus, and that will be taught in elementary schools and middle schools, so that kids are learning these skills from a very young age, and then it's really paying off dividends later in life. So as always, thank you for checking out the podcast. I hope that you all take something from this, and feel free to reach out if you have further questions on Dr. Frank and how to get in touch with him, or just on mindfulness and or bibliotherapy and working with kids. So take care. I'm excited to have here on the On the Couch podcast Dr. Frank Sileo, who is an author and a licensed psychologist. So welcome to the show.
Thanks for having me.
So how are things this morning?
A little hectic, a little running around, trying to get, the family off and trying to, be ready for patients for later. So yeah, it's a bit of a crazy Tuesday, but I'm glad to be here.
Yeah. And thank you so much for, being able to spend some time with me in and around all the craziness. So
thank you.
So wanted to kind of get a little bit of, explain what you do. How did you get started in this? Yeah, I'm been dying to hear how you start this process. So,
as a psychologist or as an author or both?
If you want to go over both, sure. I'd love to hear both.
Well, I started as a psychologist. If you read my 7th grade yearbook and you look, maybe I don't know if I want to look at it, but underneath what I wanted to be when I grew up, it actually says psychologist. And that's rare. That's rare for people to know what they really wanted to do. I mean, I've had other careers before becoming a psychologist, but certainly psychology, it was drawn. I was very drawn to it because my childhood was, for lack of a better word, very rough. I was bullied as a kid. And back then, 100 years ago, people didn't really seek out mental health services for kids or for themselves. And so luckily I had a very supportive family and a very supportive school district. And, I kind of survived, childhood bullying. And I had, wanted, as I was, growing through high school and into college, I thought I would study psychology and then wanting to help kids and adults with various issues. I never really thought I'd work with kids. When I started out, I thought I wanted to work with adults because, kids come into your office and they mess things up and, they got Play-Doh all over, they got paint and, kind of messy sometimes. And, that was my own OCD. Not that I'm clinically diagnosed with OCD, but certainly my
tendencies.
The tendencies there. And, dealing with, whatever. And so I, somehow, the niche called out to me of working with kids and adults. And I got my first job working on a child inpatient unit. And I loved working with kids, which was really rough work.
Yeah, I was going to say you have to really love kids to go child inpatient. Okay.
Yeah. So it just, I think when you open yourself up to the universe and allow whatever's to be is to be in your life, things happen. And, for me, I allowed myself to be open to that and then started working with kids and then started, doing, getting a lot of referrals and private practice. I did run group homes for children several years ago. And I got out of that because I was an administrator. I wasn't clinical and I really was tired of signing, purchase orders for toilet paper or for other things for the group home. And I'm like, I really want to get my hands back into the clinical work. So I left and I always had a part-time private practice, but then I jumped into it full-time and been doing it now I've been in private practice for over 25 years.
So how did you make the jump then into authoring children's books?
I always, as a kid, I always enjoyed writing. I had very good teachers and they always fostered my creative writing. And I enjoyed that very much. So part of my work with kids is using a child technique called Bibliotherapy, which means using books about a particular topic that in the book validates thoughts and feelings that a child may be experiencing regarding that issue. It offers healthy solutions and coping, and then that really just makes them feel like they're not alone in the world. So I work with a lot of children with medical illnesses, and I have Crohn's disease, which is a inflammatory bowel disease, and it's basically a gut issue. And symptomatology can be embarrassing and uncomfortable and painful. And so again, this niche kind of grew out of my own talking about across the country about the psychological aspects of GI issues. And I started getting referrals of kids and adults struggling from Crohn's disease to colitis to, fear of vomiting to ulcers to all kinds of GI issues. And so one day I had this little girl in my office who I was reading a book about just coping with her Crohn's disease. And she started calling me Dr. Gutsy because she knew I had Crohn's disease, but she thought like we talked about lots of things like poop and all that stuff. That's always fun to talk to kids about, and they get a kick out of it. But it's particularly hard for kids with serious GI issues. Mm-hmm. So I was reading her these books, and she was taking this book on coping, and then she noticed on my library that I had books on asthma and other kinds of childhood illnesses. And she said to me, Dr. Frank, Dr. Gutsy, how come we don't have a book on Crohn's? Because she knew I had Crohn's disease. And I said, I don't know. And so I started to think, and I started to write. And this book, my first book, published back in 2005, called Toilet Paper Flowers, emerged. And I found a publisher in New Mexico who the publisher's sister happened to have Crohn's disease. And she published books, particularly for kids with medical issues. So it was sort of a great marriage.
Yeah, that's amazing.
So I wrote this book, and people started in the book, the main character, Julia, creates toilet paper flowers to kind of give her hope and to kind of give her something to do while sitting on the toilet. And in the back of the book, it teaches children how to make toilet paper flowers. And what had happened is that the Crohn's Colitis Foundation of America, I approached them about this book, and they really liked it. And then they started incorporating my flowers into the walks and to the programs that they started to have across the country. And so I started getting invited across the country to speak about my book and speak about Crohn's disease in kids and Crohn's disease and parenting a child with Crohn's. And so it just started from there. And again, going back to my earlier statement, I never thought that I would be an author. And I also thought, this book that I wrote, Toilet Paper Flowers, was going to be one and done. And I just loved it so. And so from there now I have currently 11 children's books. And there'll be a 12th one next year, which I'll talk about later. But I just started writing about topics that interested me in my practice, what kids were coming in for, what parents were concerned about. So I started writing about lactose intolerance in kids. And then I had a lot of kids that dealt with homesickness, of going off to summer camp or leaving, separation anxiety. So I wrote a book on that. And then my publisher, unfortunately, because it was a very small publishing house, they closed. And so I acquired all the books that I wrote, and I was starting to look for another publisher, and I found Imagination Press, which is the children's imprint of the American Psychological Association. And they publish children's books on a variety of topics, from divorce and anger and all kinds of issues that children face. And so I wrote a book called Sally's Sore Loser, because a lot of my kids in my practice were having trouble with losing and winning, and being sore winners and sore losers. And so I wrote this book called Sally's Sore Loser, and it was published by Imagination Press. And we, again, have had a lovely marriage, so to speak, from there on. And then I, just wrote some other kinds of books about self-confidence and gossip amongst children, and which led me and tattling. And so I started then getting very interested in mindfulness practices and how they are very effective in the research about helping kids and adults with a variety of issues. And so I started writing on those topics.
Okay. Well, I really wanted to touch on just that idea of the bibliotherapy. Thank you for bringing that up, because I know in our practice, one of our child therapists, Carrie, uses that a ton. And the craze with, Harry Potter or the Hunger Games, that you think of throughout our lives, these different books that we've connected with, the characters or the themes and things like that. And it's such a useful tool in a therapy setting to be able to, yeah, show a kid, and it's similar to the play therapy where they're able to open up because of the story that you're going over with them, and even sometimes able to have the child write their own story, write their own books or things like that. So, wow, that's so cool.
Well, also the other great thing about it is they can bring it to their friends and their siblings, and they can share the book and say, particularly with my Crohn's book, Toilet Paper Flowers, that, it's not something that someone can catch. It really provides like a psychoeducational piece as well that, educate others about what one might be going through. But like I said, for most of my kids, they feel like they're not alone. Like they're not alone in these feelings. They're not alone in these thoughts that they have. And even adults struggle with feeling very much isolated and alone when they come to therapy, that they're the only ones that feel that way or have that experience or have thoughts about certain things. So the books really serve on many, different purposes.
Well, and I had no idea that you yourself had struggled with Crohn's. Just the idea of the therapy for yourself to be able to help other kids, and knowing what you went through. Definitely with the GI stuff, like you've already said. Sure, I mean it can be so debilitating. There's such that gut brain connection with anxiety.
Sure.
You see so much, whether there's colostomy or resection or things like that, and obviously with a lot of the kids that they grow up in these hospital settings. I mean they're like poor little pincushions that they're being poked and prodded all the time.
Sure. And your listeners who aren't maybe familiar with Crohn's disease, it is an inflammation that can be anywhere from your mouth to the anus area of the body. So it's not just a stomach issue. It really is a small bowel or large bowel issue, or an esophagus issue, or a rectal issue. So it could be anywhere there in a person's body. And, children, more and more children are being diagnosed with it. Many adults have it. Mm-hmm. I always advise people, in listening to this now, if you're having symptoms, don't panic. Certainly go to your medical doctor, seek out a gastroenterologist, have a colonoscopy done to make sure mm-hmm. that you are, doing due diligence for your health.
Well, it made me think of the tagline for the colon cancer, specifically for men. A lot of times they'll say, like, don't die of embarrassment, like go get checked, go get a colonoscopy. And same thing. Right. And I find the mindfulness piece of it is so crucial also, because a lot of times, as you well know, the doctors are like, well, stress inflames it. So, don't feel stress. And it's like, great. How do I? Yeah.
It's like when someone tells you to relax.
Yeah.
Opposite, right.
Well, and so you've had a number of award-winning books. I mean, you've had a lot of gold medals for Mom's Choices. You've had some awards with Teacher's Choices. The one that I was familiar with when I saw you speak was the World of Possibilities, where you're focusing on the mindfulness, and just to pump your tires a bit, the idea of I thought you did an amazing job at this speaking event, because it was kids and adults. It was little ones all the way up to grandparents, and you did such a great job captivating the entire audience, and it was something for everybody, and it taught a lot of really great concepts about mindfulness. So I know you have something coming up here in February in terms of speaking about some of your books. So yes. You mentioned the newest series. Can you kind of talk about that a little bit? What is that going to be on?
Sure. Well, the World of Possibilities actually was the first one that got me, as I started taking classes at UCLA and other places, of taking mindfulness classes and doing my own reading, and also cultivating my own practice of it, because I can't teach mindfulness unless I am doing that myself. And I know there's a lot of, we hear mindfulness in the
media,
in the media, and a lot of people think it's like, like you need to Om, or you have to say Om, I wear funky sandals. It's really it's a portable, practical, scientifically proven, positive, approach to dealing with life. And, there are not many things I can say that. And it's the best portable app you can take anywhere, because meditation and yoga can be done in many, many settings. So your breath is always with you. So in the world, to start with the world of possibilities, a lot of my books are written for children, but I like to think that a lot of parents and adults can benefit from them as well, because I played on the word possibilities for possibilities, because I wanted to teach kids to take pauses in their lives. We're so busy and hectic running around from activity to activity that I wanted kids to stop and tune into their bodies, into what they're experiencing, what they're feeling, what they're thinking, even if it's not so great feelings or not so great thoughts, to kind of check in with themselves. And so that was, a world of possibilities. And then I wanted to kind of expand, the more of mindfulness teachings. And I developed a series, a B series based upon a character called Bentley B. And Bentley B, my first book in that series is called Be Still, An Invitation to Meditation. And Bentley, everyone in the hive is going, is buzzing around, and except Bentley. Bentley says, you know what, before we go gather some honey, I'm going to do some meditation. And he kind of, in the garden, all his friends are kind of curious as to what Bentley is doing. And he kind of teaches them how to do meditation. And then I followed that up with a sequel called Be Calm, The Buzz on Yoga. In this book, Bentley is kind of curious about all his other friends, because they're doing all these weird poses in the garden. He's like, what is all this? Why are you standing that way? Why it looks kind of funny. And then he learns what the buzz is, why yoga is so important, how it can be helpful for him. And he starts practicing it and having fun with it. So then I just couldn't stop with just 2 books. So my publisher was gracious to grant me, kind of to write this 3rd book, which is out now, but my book signing is in February, and it's called Be Heartful, Spread Loving Kindness. Loving kindness is a type of mantra meditation, which that means is that it gives a script to kids and adults to say. And what we do with a loving kindness meditation is we are sending loving, kind intentions to ourselves, to others we love, to those we don't know very well, to maybe someone we're having a conflict with in our life. And lastly, we can send it to the world or to our community. It is a really beautiful meditation. I fell in love with it when I was studying mindfulness, because it's almost prayerful, and it's almost, very prayer-like, in the sense of sending compassion and warmth to yourself and others. And we need more love and kindness and warmth and compassion in our world today. And so Bentley in this book again returns to teach loving kindness. And in this story, he wears a red scarf in the book, and Willie Wasp comes along and steals his scarf. And instead of, he acknowledges he's angry and upset about it, which is what mindfulness is about, but also then sends him loving kindness thoughts. And even though Willie Wasp returns the handkerchief or the scarf to Bentley, it's not magic. Because we send loving kindness intentions to others doesn't mean we're going to change them, but it's the intention. And we start to feel better about ourselves and have maybe more compassion for ourselves and compassion for others. And this kind of meditation is great for kids because it gives them a script on what to say. Because oftentimes kids will say to me, and adults as well, is that when they're meditating and they're just focusing on their breath, their mind will wander.
Oh, sure.
And that's normal. That's okay.
That happens for me.
That's what the mind does. That's a great thing, that your mind is, maybe thinking about dinner or thinking about homework or thinking about your baseball game. But the thought is to bring it back to your breath and focus it there. With loving kindness meditation, it brings the focus onto the mantra and kind of focusing on the words you're saying to yourself and to others. So I'm hoping that already it's been very well received by people in the mindfulness community. I'm really hoping that the kids really enjoy it. I get often asked why I chose a bee for a character. And I thought, well, if a bee who's always buzzing and never really sits still, and is often feared, although honeybees don't sting, that if a bee can calm down, be still, and be heartful, then maybe we, kids and adults, can learn those things as well.
That's so well said in terms of the idea that our minds are going to wander, and obviously society is rife with not being still, not calming down, and for kids, I mean, are there particular issues that you really see kids struggling with today? And I mean, obviously, I see in my practice just anxiety all over the place. Yeah. Obviously, you touched on with your own childhood in terms of the bullying, and
yes.
But yeah, I don't know if you're able to speak to that, of what you see throughout the country. And
John, I agree, and I'm seeing the same thing that you're seeing. I'm here in New Jersey. So I am seeing in my practice anxiety at an all-time high. We know that it's the number one mental health concern for kids and adults. And I am seeing much more kids, or phone calls and referrals I'm getting from parents that are saying, my kid is anxious, or, not coping well with things. And they don't really have the skills on how to cope with disappointment or frustration or pressure or stress, because we can't be stressless. We can try to have less stress in our lives. I mean, stress and anxiety to some degree is not a bad thing. We need it. We need it for survival. It is there to provide us protection. We have a fight or flight or freeze response to stress and anxiety, and we come from ancestors of anxiety. If we didn't have anxiety, maybe the tiger would have eaten, our ancestor.
Yeah. Would be gone.
Right. So we need anxiety in our lives. The problem is that because we live in a 24/7 news feed world, and we live on electronic devices, and we see so many things coming at us at the same time, as we don't know, especially children, we don't know how to integrate all that data that's coming at us. And what does that mean? I mean, safe places are things we considered safe places are no longer safe. Churches and synagogues and malls and movie theaters and schools have been places where there have been violence and tragedy has occurred. So we are under we are in a different place where we have to think about, when we enter a place, maybe we're looking at where the exit sign is, or we're thinking about what is the plan. Kids are having drills in schools about what to do if there's a intruder in the school. So, years ago, we didn't have to think about those things. 9/11 really changed many of those things for us.
Mm. Well, and I'll, even as an adult, I think of that now. I'm paying attention to, the exits, or who's around us and how did they look, how are they presenting. I thank you so much for bringing up we need negative emotions, and they're a part of life. That idea of are you stressed or are you anxious, and learning how to differentiate between the two, and that concept in mindfulness of just sit with the emotion, just connect with it and feel it.
Right.
And what does it feel like? What are you thinking? So often I think we're just taught, like, you have to get it to go away. You have to shut it down, as fast as you can. And clearly that doesn't work so hot.
Right. And luckily for severe anxiety disorders like obsessive compulsive disorder and panic attacks, anxiety attacks, and other kinds of, mental health concerns regarding anxiety, there are effective treatments out there. There are ways to help kids and adults kind of manage those anxious feelings, to learn mindfulness techniques, to learn relaxation training, to change the way one thinks about and perceives things. There is help out there, and I think that for me, like I said, at least of the calls I get in a day, or if I look at my patient schedule for the day, I would say half of my patients or more are here because of some form of anxiety issue, not necessarily a disorder, but some type of anxiety that's free floating, or I mean, I don't know what it's like where you are, but in where I live, when I played sports, we had one team and it was like one time a year. Now kids are in 4 different leagues, and there's the team and the B team and the Z team. And so kids then lose confidence because they're not on that top team, but they're like overscheduled and they're constantly running from activity to activity. And they don't often get an opportunity to pause or to do what they need, to spend time with family or eat a good meal or spend time with friends or whatever those activities might be, because there's this push for, multiple activities. And I think on one level, activity is good for our kids, given the obesity issue we have in our country. So I think on some level, it's great that kids are active and moving, and, as opposed to sitting in front of video games for 4 hours. But I think that there is a great deal of pressure. And I think parents also, although well-meaning, not every kid is going to make it into the NBA or, the NFL. I think that, we need to be realistic about that, as well as the pressures at school and homework and balancing all that. I have a scale in my office behind where I sit. And a lot of kids ask, why do I have a scale in my office? I say to them, well, I have a scale because most people come to see me, because sometimes kids will feel like they have to be mentally ill or crazy to come see me. And I say, that's not necessarily the case for most people. That most people come to see me because their life is not in balance, and that maybe it's too much of one thing and not enough of another. And so my job and our job together in this room is to try to create as much balance as we can in our world and in our lives. So, maybe we're eating too much sweets and not enough good stuff. Although I'm not a nutritionist, I'm saying that, all of those factors take into account health and well-being. And so we need to look at that balance. And it's kind of an example in my office that kids refer to and talk about that word.
Man, I love that visual aid, the idea of the scales. I might steal that.
More than happy to share that. And run with it.
And I always say, going back to sort of the, CBT end of things with like cognitive distortions, I always say, black and white is easy, that like all or nothing. Yeah. And I think, especially, you were talking about kids and families being involved in so many activities and being spread too thin. It's the balance, that mindfulness, that's the hard part, the like balancing the school and the sports or the extracurriculars or the video games and the family time or things like that. So yeah, I definitely see that.
I have people canceling therapy appointments because if they don't go to the practice, they're going to be penalized. Yes. And it's like, but then the parents might come in and say, well, he's still depressed. And I'm like, well, he needs to be here. This is just as much practice as what would be applied to baseball. Some of the other. There are skills that I'm trying to teach the children, whether it be mindfulness or coping, because we need to provide coping mechanisms for all of us, because, life isn't always fair. Life doesn't always turn out the way we'd like it to. We're not going to always get into the college of our choice. We may not marry the love of our lives. We may not get that first house that we fall in love with. And that ties back to my book, Sally Sore Loser, is that how do we lose with dignity and grace? And how do we then provide coping when life disappoints us or things don't turn out the way we like them to? Because inevitably that's going to happen. And, how are we, when kids go off to college and they're by themselves now, what coping do they have to deal with, the issues and challenges that, young adults face in college and in life?
So we're starting to get into, some of the concepts or techniques that you try to hit on in your books and in your speaking events. I actually have some of my notes from when I heard you speak.
You do?
Wow. In terms of, you talked about the mindful eating, like just slowing down and pay attention to the texture or the taste. I love chocolate, so I definitely remember the exercise you did with, like you had a Hershey Kiss, or you could have like a Skittle or a Starburst, and just placing it on your tongue and notice, what sensation does that call up. Are there other specific tools or techniques that you try to use to help kids and parents understand mindfulness?
That's a very good question. I try to encourage, aside from the mindful eating, mindful walking. We take our legs for granted, and
yes,
to kind of, instead of rushing to the car, rushing into class, rushing to wherever we're going, because I often ask people when we're running around in our hectic world, what are we running to, or what are we running from? So I encourage people to do mindful walking and to feel their feet hit the floor. Sometimes it can be done in an exaggerated way in my office, which looks kind of funny, which they wouldn't do outside of my office, but certainly they can do at home. We do a lot of mindful listening exercises, where I might ring a bell and listen to the beginning of that sound of the bell, and listening to it kind of play out and then fade out, and then hear it stop. Also taking your attention outside of my office or outside of where you are and focusing in on sounds. So also, mindful talking is very, very important. Learning how to listen and speak. Oftentimes we as someone is talking to us, we are not really listening. We're thinking about what we want to say next. So those are kinds of exercises I do with my kids and my adult patients. We do yoga, if people are comfortable with that, which is mindfulness in motion. Basically, it's putting breathing and doing poses. If any yogis are out there and they're familiar with what I'm talking about, it's great stretch. It's great physical exercise, and a lot of studies on the efficacy of yoga and helping with lots of mental health issues is documented, as well as physical issues. I do a lot of mindful. I suggest people do mindful showering. You can apply, as you're showering in the morning, feeling, the warmth of this, or cold, whatever your preference is for your shower.
I'm going to go with warmth.
On your body, feeling, massaging your scalp, or, the soap, smelling the soap. What is everything, using all those senses that are around you. And like with the mindful eating, when people are really tuned into taste and flavor and time, and taking time to do that, they have like the best experience. They'll have the best, cup of coffee in the morning, or the best piece of chocolate, because we sometimes, again, in our hectic world, we're running and eating, and we're not really thinking about what we're doing. And so this causes people to pause and take the time to be, practice mindfulness in an informal way. Those are more informal ways of practicing mindfulness. The more formal ways are meditation and yoga.
And it just goes back to that old cliche of, stop and smell the flowers.
Correct.
That just take a second and enjoy where you're at and what you're doing and what's around you.
Right.
Yeah. It's so simple, and yet we take it for granted and don't do it so much of the time.
It's very true. It's very true, because, I went with my family to Disney World, and it's a great place. There's a lot of stimulation there. But if you really pause and take a step back, taking in all, not just the attractions and the feeling the heat of the Orlando heat on your body, maybe depending on the year you go, it may be uncomfortable. But that's being aware of that. This is uncomfortable. This is uncomfortable for me. But just taking that in, I give advice to people who are getting married, and I say, at some point in your wedding, just step back a moment and take in all the people that are there. Everyone that's there, the food, the decorations, everything. Take a moment to pause and just take everything in, because it goes so quickly and you can miss it. In fact, speaking of weddings, we go to weddings or we go to concerts, and we try to capture the moment as opposed to being in the moment. Like we're video.
Oh, selfie.
Yeah, we're we're recording. I went to a concert once, and everyone's recording it, and it's like, recording a wedding. And it's like, well, you're missing it, because you're missing that actual moment.
In trying to capture it, you're missing it.
And the bottom line is, I don't know about you, but is anyone really watching those videos after you take them again? I mean, really, seriously, think about that. I mean,
sure.
I mean, when I was growing up, my father took, a gazillion pictures at the dolphin show. Probably that was it. We're not, even back then, we could think about mindfulness. We're worried about capturing that moment of the dolphin flipping out of the water, as opposed to experiencing it for yourself and that wonderment. As opposed to now we have like 30 pictures of the dolphin show that as we go through them, we're like, okay, we don't need to look at these because they don't, at the moment, it seemed like a good idea to do, but it just, it doesn't really last. So I encourage your listeners to try to, instead of capturing the moment, just be in that moment, because your memory and the feelings that are engendered by witnessing something, whether it be a concert, a wedding, or a special event with your child, is so important. And they're also aware of it too, that like, watch me, don't kind of just record it. You know what I'm saying?
Mm-hmm.
Like, so, we do live in a phone culture, and that's just part of our culture right now. But I encourage people to be in the moment, as opposed to try to always be capturing every moment.
Sure. No, I can definitely speak to that even with my 2-year-old. If we pull out the phone to like take a picture or a video, he becomes obsessed with looking at himself on the phone. Like he wants to see the video again and again. And yeah, a lot of times you miss the moment then. So if, to put you in the hot seat a little bit, if you were, I don't know, the head of children's psychology for the entire country, like why is children's mental health so crucial, and what advancements do you think we need to be making? What gaps do we need to be filling? You're listening to OTC episode 38 with licensed psychologist and author Dr. Frank Sileo. We'll be right back after a brief word from our sponsor.
Would you like to talk to a counselor but can't find the time? Would you rather talk to someone from the comfort of your own home? If so, Parenting and Family Solutions is here to help. We now offer teletherapy to all clients who reside in the state of Pennsylvania. Using our secure portal, you can have a video session with your counselor using a laptop, desktop computer, or smartphone. Visit our website to learn more at www.parentfamilysolutions.com or give us a call at 717-602-5560 to see if teletherapy might be a good fit for you. Let us help you build a stronger family and a healthier you.
Wow, that would be an awesome job to have.
You say that, but
yeah, I know. I'm saying it because I don't have it, but certainly they are our future. And it's this trite, sounds trite, but it's so true. They are our future. They're going to be taking care of us. They're going to be our future. And, it's amazing to me what young people are doing socially, politically, educationally, to really, it amazes me how kids are so different and so bright and so aware of things that I wasn't aware when I was a kid.
Oh yeah.
I was just like, okay, what's for dinner? And, it's Happy Days on. And I'm dating myself by saying that. So, that was but that was very much, in a sense, children are naturally, back to the mindfulness just for a second, children are more naturally mindful than adults are. Watch them play. They're very much in that moment than adults. It is changing though, because kids are moving from activity to activity. But so if I was in charge of child mental health across our country, I would make it a priority that we have policies and, work on destigmatizing mental health. And that.
Now you're saying like classes being taught, in elementary school of like the yoga and the mindfulness and de-escalation?
Possibly, yes. That's so. I would definitely have and there are schools that are embracing this, which is wonderful. The social emotional learning aspect of things, I think that is a big part of, would be an excellent part of the curriculum, and many school districts across the country are implementing in that. I feel for teachers because they are asked to do more and more and teach our kids more and more things that they didn't think that they probably would ever be teaching it when they were in college studying to be an educator. But I do think that, one is educating social emotional learning and about expressing emotions and implementing mindfulness practices in the classrooms. But also, there still exists a stigma around mental health care and mental illnesses and mental disorders and special needs issues. And I think that, helping model appropriate and normalization to some degree that we all have issues. No one is free from any kind of issues. Yes, some may have more severe issues. Some people may be on medication for those issues. But, that doesn't mean that, being on medication is something to be ashamed about, because, similar to children who have medical illnesses, they had to take asthma medication, and we don't think twice about that.
Nope.
But when it comes to other medications for ADHD or for depression or for other mental health issues, that there's often this stigma and shame and also misinformation that I find with a lot of people. They don't really understand how they work, and that kids may not have to be on them forever, and it's vital to their development and growth at times, and that it's not in their control. They're not acting out. They're not being bad children, quote unquote. It's their brain chemistry. So I would, if I was in charge, I would, work on, creating stigma-free communities and environments and schools. I also think we continue to have a bullying issue in our country, despite having, in New Jersey, we have laws that are in place, that if someone bullies someone else, a child bullies someone else, there's procedures, and there are strong consequences for bullying in the state of New Jersey. So I think that, with the advent of social media, there is a great deal of cyberbullying that goes on. It's one of the reasons why I wrote the book, Did You Hear? A Story About Gossip, because I wanted to teach kids that how words can be very hurtful and effective, not just spoken to one another, but through the internet, where lots of kids and adults can hide behind and bully other people anonymously. And so, I think that, bullying is a mental health issue, and I think that we need to work harder on that issue.
Well, with that, I often will try to remind parents, just the obvious of, like, times have changed. Duh. It's a different world. And, unless, I always say, unless, your sibling was the one doing the bullying stopped once you got home. Like, once you were safe inside your house, that's it. It was pretty much done. Maybe you knew during school that you'd have to answer the bell after school and fight somebody or, something like that. But it pretty much ended once you got home or once you were in school. And now it's with social media, especially the trolling and the groupthink that can happen when it's, faceless, nameless.
Yeah, we live in a like culture, like, with liking on Facebook, liking on Instagram. And like my kids and even my adults will get caught up with, hey, no one liked it. Like, I only had 5 likes, or I only have so many followers. We're so caught up in counting that, and so got more likes. Does that mean that they are more popular? Well, more liked. And again, we know that social media has its, advantages as well as its disadvantages. But certainly, it can be very hurtful, and people's self-esteem is very connected to this. We know that Monday morning, that depression and anxiety rises in individuals because they're reading on Facebook or social media or Instagram that, what everyone did over the weekend, and, all these great places they went to eat and what they did, and they have the best friends of everybody. And then they look at their own lives and they're comparing themselves. Right, I didn't do that. I don't have that. And it's really unfair. And, to the listeners, and I'm sure they understand, is that, people, it's people's social resume. People put out what they want you to see about their lives. So they're not going to put out that, that they had a crummy day, or, they're failing at their jobs, or their kids are not listening to them, they may not necessarily put that out to you, or they're feeling lonely or whatever. So, people, it's their social resume. It's what people want you to see about them.
Definitely. With trying to focus parents and help them teach some of what we're talking about with the imbalance and the lack of boundaries. How are there ways that you found to help equip parents to teach some of that?
I spent a lot of time in my practice. I just don't see children when I'm seeing a child in my practice. So I start or end the session meeting with the parents, checking in with them, because if I'm rowing the boat one way and parents are rowing the boat the opposite way, then it's a waste of time and time. So we need to work together as a team. And that team could include not just parents, but nannies or caretakers or grandparents and anyone else that interfaces with the child. But every week I meet with the parents as much as I can, to kind of check in with them, not just about their child and say, how's Johnny doing with his anxiety, but also, how are you doing? Because if they're anxious, if they're depressed, if they're displaying poor boundaries, if they're displaying, negative behaviors, then how can we ask our children to change? And then the 45 minutes they're spending with me and I'm sending them back to this environment, then again, it's a waste of dime and time. So we really need to work together. So when I'm working with kids, I work also a lot with the families, and that it's really a team effort. And as I say, the room that they come to see me is not about shame and blame. It's about helping the best interest of the child and the family together, and ultimately the community. So a lot of that's just been a model that I don't think it's not just my model, but certainly it's how I've been practicing for 25 years. I think that it's been effective. Parents really appreciate that 5 to 10 minutes, just even to vent their own frustrations or what's going on with them. And sometimes it allows me then, if I can't directly help them in a therapeutic way, then it might be making a referral for them or giving them a support group or something else that might be helpful for them.
And that's one of the reasons I like working in our group practice here is, I am not able to meet with everyone about everything. And here I feel like we've done a pretty good job of rounding out the team so that, I'm able to refer to a colleague on like, hey, I think this person, this parent needs individual. Can you work with them on that? Or I'll handle the couples counseling. You handle the family stuff. Right. So, and one technique that I use a lot of times is just having people write down that list of stress producers and stress relievers. Right. And, if you were to do that as a parent of like, what are the things that you feel your kid needs help with in terms of balance, if you were to actually write that down and give a score to each of those things of like how much stress or chaos does it create in the home, and then actively target, okay, how are we going to actually make a change in, the screen time, let's say. Obviously, we're bringing that up. And as opposed to the like, we're just taking it away, they're not going to have video games or they're not going to have social media anymore. Like, what's that healthy balance?
Right. I spend a lot of time talking about video games and Fortnite and Xboxes and all those kinds of devices. At least, 80% of my week is spent at times discussing that.
Hearing about when the battle pass is coming out or the latest skin they got. Or yes.
Yeah. Yeah. So balancing, again, going back to balance, how do they balance all that out?
How do you, one of the listener questions that came in was, how do you teach younger kids to be sensitive and be inclusive about some of those things that we brought up earlier, whether that's medical issues or, how do you teach kids how to be sensitive to some of that?
I think, that is a community-based issue, but also a parenting issue that, we are their role models, and how are we modeling acceptance and sensitivity to individual differences. How do we watch what we say in front of children? Are we in the car driving home from, when we hear kids in the back of the car in carpool and they're talking about so-and-so being overweight or so-and-so not being as bright as, or getting a bad grade, are we putting a stop to that? Or are we encouraging that? Are we as parents sitting there and also after a baseball game kind of critiquing other children and saying, so-and-so didn't play very well and they messed up the game? Are we all sending that message? So I think we need to check ourselves. We need to check ourselves as parents. We need, educators, coaches, piano teachers, dance instructors, drama teachers, anyone that interfaces with children needs to look at what are we saying to kids? And what messages are we saying directly or indirectly to a child or to children that may be fostering insensitivity, lack of understanding of individual differences? Where are we as far as educating about medical issues or disabilities or other kinds of levels of issues that kids are struggling with? Are we implementing social emotional learning in our schools? Are we teaching empathy, which is lacking in and incivility toward others is at an all-time high in our country. The American Psychological Association does a survey every year, and we're in crisis as far as how we treat other people. And I'm hoping that we see that come back. Because it seems at this point, many patients, adult patients of mine as well, report a hopelessness about where we're going, where our world is going, how we treat and talk about other people. And as a person who was bullied, I have a strong sensitivity to that. And I will often, as psychologists and therapists, we don't often disclose our problems or things, but I feel and the rule of thumb is you only disclose when you feel that it'll help the patient learn or advance from what you're saying. And so one of the reasons why I disclose I have Crohn's, but also I've disclosed that I have been bullied as a child because of the difficulties I've had and what I've learned from them and how, what I'm bringing forward and how I can help them be better people and individuals and be more sensitive. Lots of prejudices and things. Kids learn. They're not born that way. And so we have to look, that's why we go back to where is that coming from? Where, as parents, why it's so important for us as therapists, psychologists to meet with the parents, to get an idea of where their head is at and what their judgments are and what their values are. I'm not here to make judgments on those values, but I'm also here to say that may be contributing to exacerbating or maintaining some of this behavior that we're seeing in your child or with children.
Definitely. And it made me think of two other people that I've spoken with in speaking with Lori Gottlieb, the author for Maybe You Should Talk to Someone. She talks about, kids aren't born hating themselves. Like they don't show up that way. You have to either do something to them or, teach them that for them to then start to do that. And the other was Dr. Jonathan Singer, who's the president of the American Association of Suicidology, talked about having worked with a 4-year-old who was legitimately suicidal. And it was just like mind-blowingly heartbreaking to even think of that. Like, that idea that it's a community issue and it's something that we have to address at all different levels.
Yes, absolutely. And I think it's going to take some time. And I always, people will come to me feeling very helpless about the current situations with people and incivility, et cetera, et cetera. And they say, I don't know how to fix this. I say, well, that's a very big task to fix it. And I don't think we can
start with yourself.
Exactly. You just took the words right out of my mouth. You begin with you. And in a very small way, if you see something or something doesn't feel right for you, stand up for someone, reach out to someone, talk to a trusted adult about your feelings, about what you might be experiencing, how you're feeling about something. I have something next to my couch where patients sit, and I'm not quoting it exactly, but we need to be less concerned about grades and more concerned about the kids sitting alone at the lunch table. So, we know that there's great programs like the Friendship Bench and things that occur at school for kids who are feeling lonely or isolated. And those are the kids that we need to reach out to, because maybe they're not the squeaky wheel, and so they can fall through the crack very easily. They're a good student, they're polite, they're nice, but they're lonely. They have troubles. They're having friendship issues. We tend to focus on the squeaky wheel, so because it gets our attention. But we need to pay attention to the child or adult, for that matter, that may be quiet. In medical illnesses, we call them invisible illnesses. Like Crohn's is an invisible illness because you may look okay on the outside, but inside you feel like not very well. So we don't always know what someone's story is about. And if we can kind of teach empathy and teaching, acceptance, we may begin that process of maybe that pendulum swinging back.
Well, it made me think of sort of answering my own question of, like, if I were head of children's mental health, the idea of, mandatory sessions for, I would say middle school, maybe not elementary school. Depending, but I would definitely start like middle school, high school. I mean, you think of, for us in grad school, you had to go to at least 3, maybe 5 sessions, depending on the program. That idea of kids getting mandatory sessions, and I think especially college, a lot of times, I know probably other counselors, or especially college and school counselors across the country, are like, oh my gosh, no, we can't handle that overload. Right. But I would say starting there also.
I mean, especially in middle school, and that's when most of my bullying, being bullied, took place. And we have lots of issues. I have a book which coming out, children's book coming out next 2021 in the spring, that deals a little bit with the issue of diversity and body positivity and body acceptance. Because as we know in middle school, who's an early bloomer, who's a late bloomer, puberty is starting to kick in, hormones. It's a very, arduous time for lots of kids to navigate. And, if we can have, more of those kinds of interventions early on, we might be able to help lots of kids navigate the waters.
Yeah, I look forward to checking back on that. One last listener question that I had was if you can give any advice to when parents are interested in teaching mindfulness and some of the mental health and education to their kids, but the kid seems resistant. If you have a kid that's like, I don't want to read this book, or I don't want to learn this stuff, I don't want to do the yoga or the meditation. Right. Have you found any ways to help with that?
Yeah, that's a good question. We never want to force kids. We want to gently introduce that, sometimes modeling it ourselves, sharing why we think it's important to do, let's say, mindfulness practices. Like for me, it's like I might be able to relate to someone. It's helped me focus. It's helped me feel calmer. When I present it to patients, I say, let's do an experiment. Let's just try it out. Let's have fun with this. And I think fun is very much important for kids to do anything, like whether they're learning math or learning mindfulness, is to kind of present it in a fun way, not as a punishment, not as, a mandatory thing, and begin with very short stints with it. We don't want to, let's do this for a couple of minutes. Let's just try it out. Doing things together. I mean, the number one reinforcer that kids want, they don't want some tchotchke. They don't want, French fries. They want to spend time with you. So I think if we kind of, instead of saying, I want you to read this book, or I want you to do some yoga poses and then walk away from it, we're not sending a positive message of why it's important, how to do it, et cetera, et cetera. Maybe doing it together might be a very helpful way to kind of get them on board. We know when walls go up, we know that and resistance happens, that oftentimes kids are feeling uncomfortable or they're feeling insecure, feeling self-conscious about it. Even adults will do that. They'll put down something because they're feeling self-conscious about their bodies or about trying something new. And oftentimes with mindfulness, there is a lot of misconceptions about, it's too earthy, crunchy, or all right, enough with the breath. Like, people tell you, just breathe. And it can feel very dismissive and it can feel overly, overused. So I think that kids need to understand and make it fun, like put a stuffed animal on their belly. Let's make the stuffed animal go up and down, or create, fun ways to introduce topics. That's why I write these books, so that, the book can be a fun way for kids to, do it along with Bentley, or, engage that way. Again, we can't force a kid to read a book, and reading along with a child a book is a very wonderful bonding experience, because it allows the child to ask questions, express feelings and thoughts, and all that stuff. So we can't say hand them one of my books and say, here's a good book on building your self-confidence. Here, read this. And I'm like, well, the kid's not going to read it because the kid really doesn't like to read. So, or doesn't want, or feels maybe even, why is my mother or father asking me to read this book on self-confidence? What does that say? So I think that, a real, we're modeling it for them. We're joining them in on it. Try to make it fun. Try to create a habit of it. Like, let's do this for the next week, and maybe offer a reward for it at the end of the week. Like, you know what? You did this 5 minutes, for 5 days. Let's, now we can do something that maybe, as a reinforcer for you. But you got to get that buy-in. And that's with adults too. If they're not going to, even with therapy, I'll get patients that, the parents give them the control and the power, and saying, you can see Dr. Sileo we'll give it 3 sessions, or they'll, make that promise. And that oftentimes will say, that sets it up for failure, because, there's certain things in life when it comes to kids that are non-negotiable, and certain things are negotiable. Therapy being a non-negotiable, medical care being non-negotiable, school is non-negotiable. You don't want to take, guitar lessons after 6 months. Okay, we can try something else. But there's certain things that, as much as kids want to have the control in their lives, when we give it to them, they don't know how to handle it, and it creates anxiety for them.
Sure.
So, anyway.
Well, yeah, I mean, obviously the, like Lord of the Flies concept, like I always say, left to their own devices. I mean, our kids would like rot their teeth out with like ice cream for breakfast, lunch, and dinner, and video games all the time.
Exactly.
So,
Exactly.
Okay. So you mentioned the one book that you have coming up. Are there other projects that you have in the pipeline? It sounds like you're always got something.
I do. The children's book that's coming out next year is called Blossom and Bud, and it's about there's 2 flowers that don't necessarily feel. One is too tall. One is Bud, who's not blooming yet, and it deals with body positivity and diversity of people, and body image issues, which are very much a part of our culture. This drive for being thin or muscular or whatever. Even for young children, I have young kids who I treat who are wrestlers, and they're very much, these little kids or their parents are very concerned about them making weight. So that Blossom and Bud kind of is coming out next spring. And then I took the leap into, I'm writing a parenting book.
Oh, nice.
That's coming out January of next year.
Okay.
And it's a specific book on parenting for parents that have children with chronic illnesses.
Wow,
so,
that's awesome.
It's how to navigate schools and hospitals and dealing with procedures and needle phobias and emotions get engendered when you get a diagnosis of your child, from asthma to cancer to all kinds of things. And I'm really excited about this. This is my first kind of adult book I've written. And man, It is. It is. I mean, writing children's book is no walk in the park. It is.
Sure.
It is really challenging to make it engaging and fun and all that stuff. But the parenting book is a different level of writing, and I chose a co-author for this book. Her name is Carol Potter, and she is a marriage and family therapist, and she's the second author on the book, and she brings the whole marriage and family issue and her expertise into the book.
And the reason that I made that noise, sorry to interrupt you, is yes. I mean, as you well know, the divorce rate is astronomical in children with needs, medical needs and things like that, just because of the strain it puts on a family. So, wow, that's awesome.
Right. So that is being published by APA as well, American Psychological Association. So it'll be out next January. I haven't started the edits yet with my editor on that. So
clock's ticking.
I'm holding on the chair very tightly because I don't know what to expect.
Now it's out there on the airwaves.
Yeah. So, and people may know Carol Potter. She is a marriage and family therapist, but she used to be an actress, and she was on the show Beverly Hills 90210. For those that grew up in the 90s,
nice.
She played the mother, Cindy Walsh, to Brandon and Brenda, Jason Priestley, and Shannon Doherty. And after the show ended, she went back for her marriage and family therapy degree, and she's been in practice for many, many years, and we've become friendly, and that's why I asked her to co-write this book with me.
That's so cool, man. I gotta say, I have this picture of you as sort of like Miles Finch from Elf. I mean, not the angry elf side of things, but like this like book of like golden ideas that like at any given time you've got like 10 to 20, sort of in the hopper there.
It's I'm always thinking, and I enjoy it. It's another creative aspect of my life that I enjoy doing. But this parenting book is taking up a great deal of time. So I'm quote unquote shelving any ideas I have right now. I have something else I'm trying to work on in the mindfulness field, but I'm kind of taking that step by step because I see about 60 patients a week, and plus editing, all that stuff. It's just
where do you find the time for all this?
I practice Sunday through Friday, so it keeps me busy. But the children's books are fun, and you mentioned awards before. I know this again sounds a little trite, but the best awards I get are the emails or calls from kids or the kids I meet at author visits in school that feel better about themselves, or feel validated, or feel learning something new from my books. And again, I know that sounds kind of corny, but
I mean, sure. That idea of like, it's nice to get the award. That's great. But yeah, that idea of being able to help, one more kid, help them deal with something you yourself struggled with. Sure. That's all the award you need.
Yeah.
Wow. So where can people find you? Where do they find you on the interwebs?
They can go to my website, which is drfranksileo.com. I'm on Twitter at Dr. Frank Sileo. I'm on Instagram at Dr. Frank Sileo. I'm on Facebook at Dr. Frank Sileo. So it makes it easy for my social media platforms. And I'm on YouTube at Dr. Sileo, actually.
Okay. And for anybody listening, the Sileo is Sileo. And I always tell people, I'll have the show notes up so you can get to it if you're driving or working out or anything like that. So no worries.
Great.
Yeah. Well, Dr. Sileo, thank you so much for what you're doing.
Thank you.
Just so amazing. You are, book by book and topic by topic, looking at the landscape of like, okay, what's missing? Where's the void? And then you're working to fill it. So thank you so much.
Thank you. But John, I don't know if you realize, but you're doing the same thing. You may not be writing a book or putting it out in a written form, but by doing the podcast you're doing the same thing that I'm doing, just in a different medium. So
Thank you. I never thought of it that way.
Thank you for doing what you do, because you're making psychology and these kinds of issues very relatable and accessible to people, just like a book.
Yeah. Well, and I always say that's the hope, to just hopefully it helps even one person, one family. So I always say, I definitely look forward to catching up with you in the future, maybe having you back on again. I'd love to see both the books that you're working on. So thank you for your time.
Thank you for having me. Have a wonderful day.
You too. Take care.
Thanks.
And there it is, OTC listeners, another episode done. Thank you for tuning in. I hope that you're all doing well. I know that these are just pretty crazy, scary times. I know there's just ton of emotion, ton of stress. So I hope you all are doing what you can to take care of one another and take care of yourselves. I said it in the episode, but again, just a huge thank you to Dr. Frank Sileo. It was such an honor to get to talk to such an amazing mental health warrior, just somebody who's out there on the front lines and really working hard to find areas where there are gaps in different books and topics that haven't been targeted, and really working hard to put out content that meets those needs and helps those children and adults that, maybe parents that maybe have a child that's struggling with one of those issues, trying to help fill that gap. So again, I hope you all are doing well. Take care, and I will catch you all next episode. In OTC episode 39, I have the distinguished honor of sitting down to talk with psychiatrist and chief medical officer for the American Foundation for Suicide Prevention, Dr. Christine Moutier. If you liked what you heard, be sure to subscribe and review wherever you're catching this podcast at. You can check out detailed show notes and archived episodes at www.pfsonthecouch.com. If you want to stay up to date on future guests and contribute questions, be sure to follow us on your favorite social media platforms. The author and host of this podcast is not engaged in a therapeutic relationship with the listener and cannot give counseling advice without a confidential appointment. Listeners should be sure to consult with a licensed therapist in their area or seek emergency medical attention if they are experiencing psychological difficulty. A special thanks to the band The Topsy-Turvies for the show theme song. Their song, Like a Living Dead, can be found at topsyturvies.bandcamp.com. The bump interview track was the song 1973 by Bruno E. The author and host of this podcast is John Dennis. Special thanks to editor and show producer Trevor Groff.